Lewis, LCSW. I'm a licensed clinical social worker, and the name of my practice is Salt Lake Weight Counseling. I focus specifically on binge eating and food addiction issues. And today we're going to talk about how I use EMDR to treat those issues. So EMDR stands for Eye Movement Desensitization and Reprocessing, which is kind of a mouthful, so we call it EMDR therapy. And realistically, EMDR is used for trauma, but trauma occurs on a spectrum. So, often people will say, well, I wasn't abused. And certainly abuse is what we call a big T trauma, so huge trauma. But often we'll have a lot of little t trauma, so seemingly innocent events that stay with us for whatever reason. So if you think about your brain, if these are the channels in your brain, those early experiences kind of get stuck there in the channels, frozen there, and they don't get fully processed through. And then anything that resembles how we think or feel about ourselves in relation to that event or think about that event, it backs up kind of like a clogged pipe. And this is where eating tends to come in. So we'll use certain behaviors to avoid feeling all of those emotions. But with EMDR, what it allows us to do is get right to the quick of the issue. So we get down deep into the core pieces that are attaching our relationship with food. We are able to process that stuck material. Other things that are related to it come along with it, or we can go back and tie up some loose ends there. So with EMDR therapy, once we've moved through some of that stuck little t or big T trauma material, then this is really powerful. I can actually use EMDR therapy to change the emotional connections to food. So if we think about our relationship with food, it serves a lot of purposes, right? Comfort, soothing, distraction, avoidance, some control when things in our lives feel outside of control, tends to be a lot of defiance when it comes to dieting, and we can actually target the best parts that food allows us to get those needs met through. It actually changes the structure of the brain. We can break those connections in ways that talk therapy just can't. So if you're interested in learning more about how I use EMDR therapy to challenge emotional eating patterns, please contact me today.